Vitamin B12 deficiency can cause some very strange symptoms, not just feeling tired. I'm talking about burning feet, brain fog, balance problems, a smooth or swollen tongue, mood changes, and even feeling short of breath. And here's what makes B12 deficiency so easy to miss. Many of the symptoms can look like there's something else. They can look like aging, stress, poor sleep, anxiety, diabetes, or just one of those weird things that your body starts doing. But sometimes those strange symptoms are connected. And in this video, I'm going to show you 7 signs of vitamin B12 deficiency that people often overlook. We'll also talk about why it happens and who may be most at risk. Stay with me till the end because long-term B12 deficiency can affect your nerves, and some nerve damage may become difficult to reverse. This video is for general information purposes only. It's not a diagnosis, and it's not a replacement for medical advice. So first, what does B12 actually do? It does quite a lot. Your body cannot survive without B12. Your body needs vitamin B12 to make healthy red blood cells. Those red blood cells carry oxygen throughout your body. B12 is also important for your brain and nervous system. It helps support the protective covering around your nerves. That covering is called myelin. Think of it like the insulation around an electric wire. When the insulation becomes damaged, the signal can start breaking down. That can lead to numbness, tingling, weakness, memory problems, and trouble with balance. So let's get into the signs. Okay? Sign number 1. Burning, tingling, or numbness. Have you experienced that? This is one of the biggest warning signs. You may feel burning, tingling, or numbness in your hands, feet, fingers, or toes. Maybe other places, but mainly those places. Some people describe it as pins and needles. Some say their feet feel hot. Others say it feels like they're wearing socks when they're barefoot. That sounds strange, but it happens. And B12 is needed for normal nerve function. When your B12 stays too low for too long, the nerves may not send signals correctly. B12 is not the only possible cause for that, but it can be one of the main causes. Diabetes can also cause nerve problems. A pinched nerve can cause them. Circulation problems can cause them. Other vitamin deficiencies can also cause them too. So do not hear one symptom and diagnose yourself. But if the burning, tingling, or numbness is new, getting worse, or happening for no clear reason, B12 should at least be considered. You can talk to your doctor about it. And this is one symptom you do not want to ignore for years. Being tired after a long day. This can feel like your battery never fully gets charged. You may sleep all night and still wake up tired. You may feel weak walking across a parking lot. You may get winded more easily. You may look pale or feel lightheaded. Why? Because your body needs B12 to make healthy red blood cells. If you do not have enough healthy red blood cells, your body may not carry the oxygen as well as it should. And when your body is not getting enough oxygen, you're going to feel it. The problem is that fatigue is easy to explain. You may blame stress, you may poor sleep, work, age, or a busy schedule. And sometimes that really is the cause. Fatigue shows up along with tingling, numbness, memory problems, or balance trouble. That combination deserves attention. It really does. Sign number 3, a smooth, red, or swollen tongue. This is one sign most people would never connect with B12. Look at your tongue. A normal tongue usually has small bumps across the surface, but with B12 deficiency, the tongue may become smooth, shiny, red, sore, or swollen. Some people also develop mouth ulcers. Others may get cracks around the corners of the mouth. You burn your tongue on hot coffee. You may blame spicy food. You may think it's your toothpaste. And it could be one of those things. But a smooth or a painful tongue can also be a sign that something is wrong with your nutrition. It may seem like a small symptom, but sometimes small symptoms are the first clue. Sign number 4, brain fog. Brain fog and memory problems can be a sign of B12 deficiency. You may have trouble finding the right word. You may lose your train of thought. You may walk into a room and forget why you went in there. You may feel like your mind is moving through the fog. Now, everybody forgets things sometimes. That alone does not mean you have a B12 deficiency. But B12 plays an important role in the brain and nervous system. When levels become too low, memory, focus, and thinking may be affected. In more serious cases, deficiency of B12 can cause confusion and other neurological symptoms. This is why we should be careful about blaming every change on age. Getting older is real, but age should not become the automatic answer for every new symptom that you get. If someone develops a clear change in memory or thinking, especially along with weakness, tingling or balance trouble may 12 being low. We're about halfway through the list. In this video, if this video is helping you, take a second to like it and subscribe. That helps YouTube show this information to more people who may need it. Sign number 5, balance or walking problems. Here's one people really need to pay attention to. Your balance can start changing. You may feel unsteady when you stand. You may stumble more often. Your legs may feel weak. When you walk, you may just feel different. Sometimes a family member notices before you do. They may say, "You're not walking the way you used to." B12 deficiency can affect the nerves involved in movement and coordination. When the deficiency becomes severe, walking can become difficult. Now, balance problems can come from many things: the inner ear, blood pressure, medication, muscle weakness, or problems involving the brain or nervous system. So this is not something to diagnose from a video. But when balance problems show up along with numbness, tingling, or weakness, that is something to take seriously. Sign number 6, mood changes. Mood changes. You may become more irritable. You may feel anxious for no clear reason. And this one can be hard to connect because mood changes can come from almost anything: stress, poor sleep, money problems, work, relationships. Life can be heavy, I understand, but the brain is part of the body, and when the body is missing something important, it can affect the way you think and feel. B12 deficiency can be connected with irritability, anxiety, depression, confusion, and other mental changes. That does not mean everyone with anxiety or depression has a B12 problem, but it can mean physical causes should not automatically be ignored, especially when mood changes happen along with fatigue, numbness, memory problem, or balance problems. Sign number 7, dizziness, shortness of breath, heart palpitations. You may become short of breath more easily. You may feel dizzy when you stand up. Your heart may feel like it's beating faster or harder than normal. You may feel weak or lightheaded. This can happen when B12 deficiency causes anemia. Without enough healthy red blood cells, your body may struggle to move oxygen where it needs to go. That can make your heart and lungs work harder. But let me be really clear. Shortness of breath, chest pain, fainting, or serious heart problems should never be blamed on B12 without being checked. You need to consult your doctor. Those symptoms can have many causes. Some of them can be urgent, so you need to check with your doctor about it. Why does B12 deficiency happen? A lot of people think B12 deficiency only happens to vegans and vegetarians. And yes, people who eat little or no animal food may be at risk because B12 is mainly found in animal products. But that is only part of the story. You can eat meat, eggs, and dairy and still become deficient because eating B12 and absorbing B12 are not the same thing. Your body has to release B12 from food in the stomach. Then it has to connect with a substance called intrinsic factor. After that, it is absorbed into the small intestine. If something interrupts that process, your B12 level can fall. Possible causes include low stomach acid, pernicious anemia, stomach surgery, weight loss surgery, digestive problems, certain medications, and changes that happen as people start to get older. Here's another reason it can be missed. The body can store B12 for a long time, so the problem may be developing for years before the symptoms become obvious. Let's talk about who may be at higher risk. People at higher risk may include vegans, strict vegetarians, older adults. People who have had stomach or intestinal surgery can be at risk. People who have had weight loss surgery. People with pernicious anemia can be at risk. People with certain digestive conditions can be at risk. And people who take some medications for a long time, including certain acid-reducing medications. So again, the problem may not be that you are not eating enough B12. The problem may be that your body cannot use what you're eating. What are some foods that contain B12? Let's talk about that. Some of the richest food sources of B12 include clams, liver, sardines, tuna, salmon, beef, eggs, milk, and cheese. Some cereals and other foods are also fortified with B12. But if the problem is poor absorption, eating more B12-rich food may not be enough. This is why finding the cause really matters. One person may need to change their diet. Another person may need supplements. Someone else may need injections. The right approach depends on why the deficiency happened. And consult your doctor about that again. How is B12 deficiency checked? How do they check it? A basic blood test can measure your B12 level. But one number may not always tell the whole story. A medical professional may also look at your symptoms, your medical history, your medications, and whether you have had stomach or intestinal surgery, and other tests. Those tests can sometimes help give a clearer picture. Now here's the biggest danger. The biggest concern with long-term B12 deficiency is nerve damage. Some symptoms may improve after treatment. Fatigue may improve, anemia may improve, but nerve damage can sometimes become permanent if the deficiency continues too long. And that is why burning, tingling, numbness, weakness, balance problems, and walking changes should not be ignored. Don't ignore them. This is not about panicking or being afraid. This is about paying attention early, catching it early. So let's quickly go over the 7 signs again. Burning, tingling, or numbness. Fatigue and weakness. A smooth red or swollen tongue. Brain fog or memory problems. Balance or walking changes. Mood changes. And dizziness, shortness, and breath or heart palpitations can be some symptoms. None of these symptoms automatically mean you have a B12 deficiency, but they are worth taking seriously. Write down what you're experiencing. Pay attention to when it started. And talk with a qualified medical professional. Do not try to diagnose yourself from this video, because B12 deficiency can start quietly. But if it affects the nervous system for too long, the damage may not stay quiet. Subscribe to this channel for more clear and practical videos about health, nutrition, and warning signs you should never ignore.